Let me ask you guys a quick question. How many of y'all in the audience know a friend, family member, or someone in your community that's been sick, disabled, or dying? Wow, most of you, or almost all of you. So just imagine you've experienced the system, and I think truth, our healthcare system in this country is completely broken. So, and our dare for today is, let's dare people to try to fix it. Topic of today's speech is, does our healthcare system need a lobotomy? So for those of you who don't know, 60, 70 years ago, one of the standard treatments for mental health and mental illness in this country was literally a lobotomy. They used to drill holes in your brain to remove a piece of the frontal lobe, and then one genius doctor decided you could put an ice pick-looking instrument through your eye socket to remove that piece of the brain. If you thought this was odd, seems like very cruel and barbaric, this was commonly accepted healthcare practice in the US, to the point where the president's sister, JFK's sister, actually had a lobotomy performed on her, which left her in a vegetative state the rest of her life. The doctor who invented this won the Nobel Prize in Medicine in 1949. Why am I telling you guys this story? Everybody knows today the healthcare system is very broken. Just the way that we look back today on how inhumane and barbaric a lobotomy was as recently as 60 years ago, how will we look back a couple of decades from now on what's going on in healthcare today? And I think that should hopefully inspire people to build better solutions. Quick background on myself. I'm the CEO and co-founder of CareYaya Health Technologies. We're running one of the fastest growing healthcare startups in America, and we're building a novel care delivery platform and applied research lab to revolutionize the way we're doing care in this country. A little bit of background, grew up here, went to school here, started my education here, and then a few years ago, this is me in my mid-30s, I was running a $250 million hedge fund in New York City. This is me today. I'm back home building a revolution in healthcare right here in the Research Triangle. So you may wonder, what happened? It's all fun and games, right? In my mid-30s, I actually found myself suddenly a caregiver. Initially, I'd seen my mom take care of my grandfather through serious illness and end of life. And then it really hit me firsthand when I became a caregiver for my wife through cancer, serious illness, at this point was in a medical coma. I actually realized and experienced firsthand the struggles that families face, that caregivers face, navigating the healthcare system, and really how many millions of people are going through this. Over 50 million Americans are struggling every day with serious illness, disability, navigating a completely broken healthcare system. And the struggle is real. High cost, lack of access, lack of family caregiver support. So the purpose of today is to share 13 reasons why I think healthcare is broken, not just statistics, but real people's struggles, and really inspire an urgent need for change. I think many times in interacting with the system, individuals feel really powerless. But I think together, and as you'll see, we can create rapid change at a grassroots level. Reason number one, your grandparents are worth millions of dollars to the healthcare system. Check out some of these statistics. For older adults in this country, the US spends 4 times the average per capita that they do than in any other country. And it's interesting that up until the age of 55 or 60, healthcare spend for the population is about the same, but 60 on, it skyrockets. Specifically, look at the usage of healthcare. It's a $4 trillion system in the US. Of that $4 trillion, 50%, or $2 trillion of healthcare spend is going into 5% of people. If you don't think that's shocking enough, look at it the other way. The bottom 50% of society comprises of 3% of healthcare spend. I mean, it's shocking of the inequity in access in healthcare. And if you think about specifically on the older adult population, how much are really underserved? All of this long-term care, dental care, eye exams, hearing aids, not covered by Medicare, a private room in a nursing home, $100,000 a year. And the saddest statistics of all, 25% of older adults in the last month reported that they had to cut back on basic needs like food, clothing, utilities to pay for healthcare. It's really mind-numbing. Number two, the McDonald's problem. 60% of health risks are modifiable by behavior and lifestyle. Only 10% of your healthcare is actually when you interact with the system. 60% of it is based on behavior and social and environmental factors. But sadly, there's no money in prevention. So we talk about preventive health all the time. Healthcare system doesn't really care. Common chronic ailments like diabetes, hypertension, heart disease, many of these are preventable with education to guide lifestyle choices, nutrition, exercise, smoking cessation. But treatment of chronic disease is 1,000 times more profitable to the system than prevention of chronic disease. So I think this is something interesting that people have to take into their own hands. The ER is a new doctor's office. I'll go backwards on this, but 44% of ER visits in the last year could have been handled in a primary care setting. Think about that, and we'll come back to that later. People don't have access to preventative care and primary care, so they're going to the ER as like a way to access the doctor. If you think about the older population, 29 million annual ER visits, and 36% of all hospitalizations were older people. Number one reason for that was falls. 88% of these incidents of hip surgery, hip fracture are caused by falls, and these could have been totally preventable with better fall prevention at home. Caregiving burden, I think this I've dealt with firsthand. This is something we're really directly solving, and I think this many of you might see within your families. Traditional home-based care costs $30 to $50 an hour. Families are just not able to afford a home care help. So many people drop out of the workforce to provide care themselves. What does that result in? 50 million unpaid caregivers in America. 1 in 6 people in this country right now that's above the age of 18 is taking care of somebody within their family without pay. 36 billion hours of unpaid care, $600 billion of what the economic value would be. This, I think, generationally compounds the financial burden on individuals and families. Impact to careers. Have felt this firsthand. I've seen tons of people go through this. Harvard Business School put out a research on the caring company saying 1 in 3 employees across the country have quit a job due to managing care for a family member, and the majority of that is care for an elder parent or a spouse with serious illness. I think this population, I think this problem is going to skyrocket in the population this decade. As our country ages, the population support ratio, what they would consider how many older people there are in the country that need care compared to how many middle-aged people there are to provide care, is collapsing from 7 to 1, where it's been over decades, to 3 to 1. There simply are not enough people, and that's because the baby boom was followed by the baby bust. There simply are not enough people to take care of our aging population here, so many people are going to have to do it themselves. This, I think, is also another really interesting point. Reason number 5, the pandemic without a vaccine. What if I told you guys there's a disease that 7 million people in this country have that's going to grow 50% in nature over the next few years, and there's no treatment? Dementia. Probability increases by age. At 75 plus years old, your probability of dementia goes to 33%. And 1946 was when the baby boomers started. So 2021 onwards, this decade is when this massive population cohort is turning 75. I think there's going to be a skyrocketing incidence of dementia. On top of that, loneliness results in a tripling of dementia risk. And the elder population just went through a few years of social isolation and loneliness due to COVID. And worst of all, even a mild COVID infection is showing symptoms in the brain that are very similar to early stages of Alzheimer's and dementia. So I think these 3 reasons are going to lead to a dementia absolute pandemic over the next 5 years. And we see this directly in North Carolina. There's going to be a 50% plus increase in the next 3 years. Reason number 6, middlemen make the most money. In our $4 trillion healthcare system, this is just a shocking statistic. $2 trillion is lost every year to middlemen, waste, administrative spend, and profit extraction. Only 1.9 out of the $4 trillion we spend on healthcare actually goes into direct healthcare. It's like shocking. Then think about inequities. Dementia does discriminate. Black older adults are 2 times as likely to die from dementia as white older adults. It's a shocking difference. Another interesting statistic, in the last 5 years of life, a typical white family will spend 30 years of their entire savings on dementia care. In a black family, 84%. Imagine all those situations where there's a healthy spouse who still remains alive after that. What money do they have left? Speaking of the caregiving burden, there's also an inequity in gender. Women are 2 times as likely to be caregivers as men. Women are also likely to spend 2 times as much time caregiving as men. And then look at the second order effect. Due to our broken care system, caregivers will be 30% more likely to suffer from chronic health conditions, 34% more likely to suffer from depression. Really shocking statistics. Death by loneliness. I think this is a kind of a quick point, but lacking social connections is as dangerous as smoking 15 cigarettes a day. It's a really shocking statistic there. And the Surgeon General just put this out. Lacking social connection is more dangerous than obesity. And 35% of older adults, and actually over 20% of the entire population, self-reports loneliness and isolation. stress, inflammation, reduced immunity. And it results in everything from premature mortality, heart disease, chronic health conditions, et cetera. Reason number 9, digital health literacy. Older generation hasn't heard of ChatGPT or any tools. And if you look, 27% of older adults use tech to manage health. Many more people could. 80% have even difficulty utilizing documents, navigating forms, charts. Many people encounter fake news online and they don't even know, that it's fake. Just surprising statistics. Reason number 10, there aren't enough doctors. 83 million people currently live in areas of the country without access to a primary care physician. Think about that statistic. 1 in 3 Black Americans don't have access to a cardiologist. Half of all doctors in the country are about 55, close to retirement. And there's already a physician shortfall, which the American Medical Association expects will rise to over 100,000 over the next decade. Supply-demand of our healthcare needs compared to the healthcare workforce is really shocking in the gap. And reason number 11, most of the doctors are white men. The representation of women in healthcare is shockingly skewed towards entry-level roles. And as you go upper in the echelon of the healthcare system, less than 32% of higher roles in healthcare are women. Similar by race, 32% of the US population is Black or Hispanic, but only 10 or 11% of doctors are Black or Hispanic. Everyone knows that a diverse healthcare workforce can result in better outcomes, everything from health equity to patient satisfaction with clinician, et cetera. And yet, we know the statistics, somehow it's not solved. Number 12, healthcare is a maze without maps. 46% of people don't even understand their health insurance benefits. 62% of family caregivers find it difficult to navigate the healthcare system on behalf of a loved one. Even the physicians can't keep up with the changing Medicare regulations. And most hospitals don't even post prices online. And this is kind of one of the worst of all. Look around you, right to your left, to your right. Sadly, everyone here is going to die, 100% of us. And right now, a death in America is without dignity. 100 years ago, majority of people died at home. Today, less than 30% of people die at home. And we titled the slide, "There's no place like home to die." I think that's totally true. If you look at surveys of people, 7 in 10 people report they would prefer to die at home. But most know they won't. So with all that sad stuff aside of how broken the system is, where will healthcare go from here? And I think these are kind of the opportunities. We think home is where your health is. And I think there's a huge opportunity in this country at the grassroots level to bring a lot of healthcare delivery back into the home. This is what we're working on at CareYaya. How can we transform this current facility-based care model that we've been living in for the last 50 or 60 years and bring healthcare back into the home? What if, imagine a future where you can get care help at home, you can get a diagnosis at home, you can get therapeutics at home, and you can get care navigation at home. What if the entire healthcare system moved care delivery back into the home? Your health starts declining, and you can request a caregiver to come and help activities of daily living from the comfort of your home. We started working on this project backed by AARP and HTech Collaborative, and pleased to say we've launched a next generation care platform. You can book care online in less than 2 minutes. Somebody comes and helps you. These are vetted and motivated college students pursuing healthcare careers. Best of all, we've undercut on pricing, and it's only 15 to 20 bucks an hour, half the cost of traditional home care. And it's just gone absolutely viral. We've launched this less than 2 years ago, actually right here out of UNC, and pleased to say we have over 10,000 student caregivers at top universities across the country, UNC, Duke, Harvard, Stanford, et cetera, doing care. And I think we're on track to get 500,000 students on this within the next year. These are our future doctors and nurses, and they're going out and taking care of people in their communities. Awesome to see intergenerational relationships here forming. There's actually a lot of evidence of slowing cognitive decline as elders interact with younger students, which is really cool as a side health benefit. Now, what if you start noticing symptoms? You can receive a diagnosis at home using technology from the comfort of your home. And this is also another project we've started working on, backed by Harvard Innovation Labs, bringing a lot of point-of-care diagnostics, digital health tools, help you manage cognitive decline, cognitive screening, diabetic retinopathy. There's so much care delivery and diagnostics that can move back into the home. And now what if you need therapeutics? You can get on your phone or iPad, and there are digital health tools to help you, and traditional medicines brought to you, all from the comfort of your own home. You don't have to go anywhere. This is another project we've started working on with the National Institutes of Health and Johns Hopkins, building a lot of digital health tools to help people navigate therapeutics really from the comfort of your own home. And best of all, you need help navigating this confusing care system we live in. And community health workers are available on demand to help you navigate your and your family's healthcare and social care needs. This is a first of its kind pilot proposal we're working on with Medicare and Centers for Medicare Innovation to bring thousands of care navigators virtually to people's homes. So, basically the result, and this is where I think the country's healthcare system is going, is if we and other organizations and grassroots efforts can pull this off, you can afford the healthcare you need, you can enjoy your experiences with healthcare, and really, best of all, you can prevent chronic disease and decline. And I encourage everyone to imagine a future where care gets the place it deserves in our society, families are supported at every stage of their lives, and caregivers are empowered to respond, not just to respond, but really to prevent health problems. So thanks everyone for taking the time, and together let's build the future of humanity's healthcare.